Hello, welcome to another one of our videos, and today's a bit of an interesting one where I'm going to be discussing the value of cortisone injections in relationship to dealing with injuries, more specifically hip and shoulder injuries. They're the ones that I often see this type of treatment used the most, and I'm going to discuss is there anything you should be aware of, or is it that could create problems ongoing. Alright, so let's get into it. Okay, so why are cortisone injections used? Well, I've been doing this nearly 20 years now, and I can't tell you how many people I've seen with help with a massive shoulder problem or hip problem that has been left festering for a long time when their first initial treatment was just to give them a shot, an injection into the area that's inflamed, and just hoping that it resolves the inflammation and everything comes back to normal. But for the life of me, I cannot understand how that is the only form of treatment used. If it's used in conjunction with other things, I could probably see its use or its benefit maybe being applied to help speed up the process of resolving the problem. But when it's just the only treatment and ignoring what actually caused the problem in the first place, it seems pretty crazy to me. So this is something that I've come across quite a lot. Obviously it's used in other things as well, which I'll discuss shortly, but in particular for these areas like hip bursitis and shoulder bursitis are two of the main things that I see. Both hip ball and socket joints, both unstable and lots of factors to consider, but just trying to use an injection seems crazy. So many people prefer this type of treatment as well because it's like a quick fix. There's no sort of effort on their behalf to do anything. Works pretty quickly in terms of settling down inflammation, but does it really change anything for the reasoning of the inflammation? No, it does not. And unfortunately these sort of pictures here are pretty much the modern lifestyle. If you're watching this video, it's fair to say you're not. You're probably in this queue, but unfortunately you're the minority, not the majority. So most people are looking for that magic pill. Now, before I go on, I'm the first to admit I don't know everything. I don't claim to know everything about injuries. I'm always learning as I go, and there's certain things that I don't understand, and I need to refer out to doctors as well. So I'm not trying to say that that I know more than doctors when it comes to specific movement-based things. Possibly I have a better understanding of what that's how that happens and what to do, because that's all I do. I don't deal with other more if it's from a car accident or something, obviously I'm not the person to help you with. But if it's from a movement based thing or a postural thing, definitely this is something that I think is really overlooked in society, where we're just treating everything for a quick fix and just to get rid of pain instead of understanding why the pain is there. So we're coming back to where this relates to me, where I see a lot of problems in the treating everything as the same, is that everyone's given like a template of treatment for their injury in an area that, like the hip and shoulder, that are complicated. Well, it's a great idea to reduce the inflammation. It's never good to do this without asking why it's there. And even though two people could have the same type of injury, or same symptoms, even the same result on a scan, the reason for it could be different. So you can't just use this one-size-fits-all approach. You need to use an assessment-based process of looking for like what are the things that are associated with causing this in the first place. I can't just go to reducing pain and using the same thing I used with the last person that worked, because it may not work with this person. So before we move on, it's probably a good idea to explain what cortisone is. Most people would be aware of like what it does do, but it is an anti-inflammatory medication. It was discovered a fair way back. I didn't realise this until you look into it more, but 1950 when it was discovered, and it started from 1951, used as an injectable form of treatment. So acts on both the acute and chronic phases of inflammation to reduce both the tissue swelling and the subsequent scar formation. So that's why it works quite quickly, because it gets straight into the affected area. They're also used to treat inflammatory arthritis conditions like rheumatoid, psoriatic arthritis, and various other types of autoimmune diseases, which I know all about because I've had this done to my hand. I had 3 injections into my hand for significant swelling, and I'll explain the difference between this and the ones that I'm talking about in this video, because arthritis is in different categories. Inflammatory arthritis is much different to osteoarthritis, which is the main one that most people are associated with. So as you can see here, so a normal joint, and you have synovial fluid in between. It's like a little cushioning that between the bones, so they don't rub together, and cartilage around it to give it support and strength and bursts and all these sort of things. The tendon, that creates all the strength to move, and the muscle obviously as well. So a normal joint looks like that. Osteoarthritis, there's no, as you can see here, it's bone on bone. All of this has been eroded away. With rheumatoid arthritis and in psoriatic arthritis, which is what I have, it's actually the exact opposite. It's actually an excessive amount of fluid, not a decrease, it's an increase. So the pain is extremely painful. I can tell you from first hand how painful this is when you've got this sort of stuff going on and a huge amount of swelling. But the treatment is exactly the opposite. All right, so all the reasons for it are completely different as well, even though the pain in the area feels the same. All right, so it's really important to understand there's a decrease in synovial fluid for the osteo, and there's an increase in the inflammatory arthritis, which is really the immune system attacking the body, where this is really a result of poor movement. All right, so the reason that the cortisone is used for rheumatoid and things like that is because if something is not done, there's actually bone erosion. So the bones can actually start to erode, leaving you with a permanent disability and mutated joint disfigurement. So it's extremely important to actually get on top of that as quick as you can, because that's exactly what happens. Osteoarthritis is not the immune system, that's just based on poor movement, where you've been ignorant to the bones moving poorly, and then it's eroded all your cartilage, and now you're left with this bone-on-bone feeling. So while the injections are very important for an autoimmune disease, they're not a good solution for osteoarthritis and musculoskeletal type things that they're commonly used for. If anything, they cause more problems, which I'll show you in a minute. So long-term damage from cortisone injections, and I don't think many people are aware of this, but basically cortisone weakens the tendons, and it has been shown to accelerate cartilage breakdown. So to me that seems, while it's reducing your inflammation and pain, it's actually having this long-term problem, which is going to leave you on a consistently weakened and more vulnerable joint that's more prone for further damage and bigger problems ongoing. So it's sort of crazy to think that this is a good idea. So basically it inhibits the cells that can help repair the damaged tissue, and therefore weakens the tendon further. All right, so in many studies it's shown to accelerate degenerative osteoarthritis through cartilage breakdown. So if we go back to that picture from before, you can see like the cartilage gets completely worn away. So the blue cartilage is surrounding the bone, so they don't rub together, and you've got the synovial fluid, it's all gone. You know what I mean? So if you've got an injection that's going to accelerate that, I don't know why you would want to do that. I understand you want to be out of pain, but is that worth it? Because long term you're going to be left in more pain. So as I've mentioned here, if you have a problem with the integrity and strength of the tendon, why would you do something to make it worse? Makes no sense. Wouldn't you try to strengthen it? And if that makes the tendon weaker, why would you try to do that? Anti-inflammatory medications as well. Another thing that are used in conjunction, again, to try and reduce the pain and the inflammation, and in all fairness, it can be useful, both of these, if they're used in conjunction with other things. But if they're done as the only form of treatment, you're going to end up in a worse place. So, now, as I mentioned before, joint instability is the true cause of osteoarthritis. So this comes from ligaments that become weak and overstretched, that forces the body to react by sending fluid to the joint to correctly stabilise it from further damage. That's why it'll swell. The weakness is the end result of poor movement strategies. So it's not being old, it's not bad luck. So that's why young people can have osteoarthritis if they've done excessive amount of running. They've sort of used millions of repetitions to actually accelerate the cartilage loss. So you don't need to be 80 years of age to end up like that. You could get it when you're 30, even 25 if you've been moving really poorly early on. And all you need is a lot of bad movement, and eventually you just wear it away. So using cortisone, and that, as we've just discussed, makes things weaker. So now it becomes even more unstable. So you're going to so the body's going to react by sending fluid in an attempt to stabilise it, makes it swell. That makes it even weaker, and you can see it's a vicious cycle that just accelerates. So if the instability is left unchecked, eventually causes, if in the case of this in the knee, for this knee example, it causes the meniscal cells to drown to death. So they drown within the synovial fluid, and this is the beginning of your osteoarthritis. So you can see erosion of cartilage, fragments of cartilage, bone exposure, cartilage injury. There's the normal knee. You can see like there's lots of good cushioning in between it, so it's all functioning nice. This is not functioning nice at all. So scientific studies, there's plenty of these that discuss this. There's one that I found, the Journal of Radiology, where they looked at 459 patients who received 1 to 3 cortisone injections to the knee or hip. Of those patients, 36 of them experienced adverse events in their joints, shown on medical tests like MRI. Basically what they saw was an acceleration of the patient's osteoarthritis progression, as well as other negative effects that result in rapid joint destruction with bone loss. So 36 out of 459, it's not even quite to 10%, so it's 8%. You would think, okay, that's not a lot, but that's still quite a few. And there's ones that maybe didn't, out of this study, that maybe didn't show any improvement. So maybe they didn't experience the adverse events, but they maybe stayed the same or slightly worse instead of significantly worse. And it's hard to say how many, but again, like if you were using something like these injections in conjunction with physiotherapy or other things, there's a better chance of resolving the cause of the problem while using something to reduce the inflammation so they could move better. Another study here from the NIH, so intra-articular corticosteroid injections more effective in pain relief in the short term, but this pain relief did not sustain in the long term. Intra-articular corticosteroid injection resulted in a greater improvement in passage range of motion, both in the short and the long terms. Another example of where it's used, and if it's on its own, it's probably not as effective as it could be, and their side effects, as we've already discussed, can be a big problem as well. Another thing to consider is more so to do with the anti-inflammatory NSAIDs medication. They can really have a big problem on gut health, and this really can throw everything off the rail. It can even lead to an autoimmune problem, with gut problems. So you really don't want to be messing around with gut health if you've already got something else. It really just sets everything in motion. And these have a direct impact on your gut health because of what they do. All right, so that's something else. I won't go too much into detail on this, but just something to keep in mind. A lot of people aren't aware of the problems that these medications have on gut health. Okay, so what should you do? If it's clear and not good for you in creating weakness, what should you do instead? Well, a simple way of looking at for the underlying cause. If your injury wasn't because of an accident, you were hit by a car or you fell off a building or something, then you really can categorise it into two things. There's muscular imbalances causing compensation and compression of joints, or there's long periods of soft tissue degeneration and atrophy of muscles and tendon strength. So maybe you're not moving enough or moving certain things enough. there's a lack of strength because you don't use it. Maybe there's a way that you're doing that's created an imbalance. Either way, you could have both of these at the same time. You could be more one than the other. But these are where you basically want to start with, and they're both all going to come back to posture and movement. All right, so until these problems are identified and changed, you'll get stuck in this constant state of pain. So you'll have an increase in pain, you'll not be moving as much, and you'll have a reduced mobility and movement of the joint. Then you'll have an increase of synovial fluid to make it more stable, which then creates more acceleration of weakness and more pain, and round and round you go. So you'll never get anywhere, or just keep it. And if you just keep trying to reduce pain but don't improve how you're moving, you're going to end up in this cycle. All right, so the 4 factors that people should sort of focus on: modulating inflammation. This basically means trying to control the amount of pain as opposed to trying to just remove it or eliminate it. So you're trying to manage it, find ways to manage the pain so you can reduce the inflammation. So then you can get into the next bit where you can resolve the tendinopathy. So it means times trying to strengthen and restore function back to damaged tendons. This will help you improve your synovial fluid levels because you'll be more stable, decreasing the further damage and getting more control over the problems, and then protecting collagen health. So there's eating better diet, but also the way you exercise can really improve both of these two, which I'll get to in a second. So the last 2 factors I put here are related to improved movement strategies, and you'll really make a big difference if you can sort of work through things in this order. All right, so the stability and movement skills. So anyway, break free pain cycles, learn how to move effectively. So before you're even trying to start to get stronger, you just need to understand what is the more effective way of moving. So example, learning how to bend correctly, learning how to create better gait patterns or single leg stability. So these aren't necessarily strengthening of muscles and tendons, more strengthening of the brain. The cortisone injection will not address this problem at all, because just by doing that and not addressing your movement strategy, you're basically, even if you reduce the pain, you're just going to go back to the way you were moving before anyway and end up in the same place. All right, so the body will be forced to compensate around the affected area because you've shown it nothing new of what you did before that caused all the problem in the first place. All right, so that's why you have to really spend time learning how to move correctly before you just try to throw strengthening methods. So once again, as I said before, there's no template, so it's impossible for me to tell you what exercise to do because I don't know how you move. I don't know what's unique to you, what's the way that you do, your age, your occupation, your hobbies, previous injuries, how you sleep. There's so many things to consider, and basically, like I put here, the human body is like a system of many systems, so each system can throw itself off from the one to the next, and the things that are unique to you, finding the ones that have the biggest weakness or the biggest problems, if you can address them, you can make big difference. You may not be perfect, but you don't necessarily need to be. You just need to make improvements over the ones that are the biggest problem. So with specific exercises I might use will differ depending on the person, obviously in the injury as well, so hip exercises versus shoulder ones. So how do I know what to use? Well, I don't. I just used to use assessment, like I've said, working my way through simple things like mobility restrictions first, trigger points, loss of range of motion, then looking at joint stability and the way that you're moving, so the movement patterns, then working through isolated strength and then functional strength. I sort of through that order. I'm really trying to do all of them at the same time. It's just this one's the hardest because it's usually the one that will provoke the most pain. These ones are a lot easier, but they won't really provide the biggest difference that this one will. But I sort of need all of them at once. All right, and it's the old sort of power is one that we feel related to sports and that, but for most people it's these first 3 that make the biggest difference. So there's tons of videos on my channel where I've gone through this before, like 5 ways to improve mobility, stability, a scapular stability drill, so really important for any shoulder injuries, other mobility stability drills, single legs, this one's a great one for hip pain and hip bursitis type things, so where you're bringing in foot stability as well. So there's tons of videos. The more functional type ones, so looking at bending patterns, like each pattern here, but bending patterns, so all the different things as you can see here. So I take you through 10 of these things that I might use to improve this action. Same with pushing for shoulder problems. So you see shoulder mobility, scapular stability, strength and power, squatting, so ankle, hip, knee. All these videos, you can check the description below because I'll leave links to all these things so you can look for, okay, well, if an injection's no good, what should I be doing? I'll put things there for you. And the last thing to probably consider with all of this is the way you live. So this comes back to that collagen, those last two factors we spoke about before, about collagen strength and tendon and connective tissue strength. This is a real important part of it because you could have all of the right exercises, but the way you do them may not be as effective. So the joints and muscles bound together by connective tissue, and this tissue consists of tendons, ligaments, cartilage, intramuscular and fascia. So we saw that picture before where we saw all that. When we apply muscular force, like with strength training, we think it's all to do with the muscle fibers contracting, when in reality it's more to do with the connective tissue transfer to transport the force. So the collagen in connective tissue indicates as much as 80% of the muscular force is attributed to this. So basically it acts like a shock absorber to the joints, and the more you have, the better. All of these connective tissues are primarily made of type 1 collagen. So collagen we associate with skin, but it's a very big part of the connective tissue makeup. And this little cross-weaving pattern here is really important. So when the tissue is structured like this, it's very strong. If it's designed like in parallel formation, that's when it breaks again. All right. So if you're someone who's constantly getting injured, it's probably due to the fact that collagen fibers are not correctly aligned, so they don't form that basket weave pattern that I just discussed there. All right, and that's what provides a strong and healthy structure for movement. So the collagen that is impaired by scar tissue tends to heal in a parallel pattern as opposed to the cross weaving, and that makes further damage more likely and constant and chronic, making further weakness more unstable, as we saw before, and then your cartilage breakdown and so on and so on. So the key to making a difference with this is trying to do things with deliberate slow movement. So you can improve the strength of the collagen fibers and allow your body to build much stronger connective tissues. And this is discussed in great detail in a book called Built from Broken by Scott Hogan. You can check that out. So using slow tempos and isometrics are important. Isometric just means statically holding a position as opposed to moving through it. So for example, holding a squat for 5 seconds or 8 seconds or something like that. This is extremely important for those people suffering with a chronic joint pain, because it can be tough trying to restore the ability to the joint, because you might have a lost range of motion. In this case, you don't really need a great deal of range of motion. You just need to be in a good position where the joint's where it needs to be, and then applying the slow tempo to rebuild the strength of the tendon. So several studies show that it can provide the following benefits: reduce joint pain levels quickly with low injury risk, reduce the cortical inhibition, which enables greater muscle gains, recruit small motor units to increase force production, and prevents reduction in bone density with aging and increases the mineral content of the injured bone. So I've done videos on this before, specifically for legs and lower body things, and isometric examples for upper body exercise, because the choice of exercises are a little bit different than you would with a normal exercise. You can't use just normal exercises all the time. So an example here would be a decline board. I use this specifically for knee injuries like ACL, full knee reconstructions, where we can, and it's shown on these things, to have a significantly higher muscle activity of the rectus femoris and lower muscle activity of the tibialis anterior with normal squat exercise. So I can really hone in on the area that's become weak due to the injury or the operation, and with little risk, and I can get in a good position because I'm cheating on the movement. All right, so I can rebuild the injured area quite quickly doing this sort of a method. So the main thing to understand from this video is the cortisone injection will do nothing to address the source of your problem or the reason for your pain. If you're using NSAIDs, as well as you're likely to further weaken tendons, plus probably end up with gut health problems. So while it's Definitely a slower process of trying to address the mobility, stability and strength. It's a much better solution for long term. Plus you don't have the added side effects that come with all the other problems or treatments that we've seen before. So questions, comments. I can't give you specific things on everything, but I have got online programs you can download for knee problems, back problems, shoulder problems, even hip problems. I didn't put the video of that here. So piriformis syndrome is a big one that I come across a lot. I'll leave the links in the description underneath for you. Check them out, and hopefully this video gives you some information that maybe you didn't know before. Again, you probably could use cortisone treatment injection if you're doing the other stuff with it, and it could be beneficial too, but on its own I don't really see much use in doing so, especially if you're not addressing the reason for it. Alright, so I hope you enjoyed this video, and we'll see you on our next one.